Okay, I'm going to visit with you today on the bouncing back. We're going to discuss low back pain. I know a lot of us, those of us that are young at heart and are wanting to bounce back from chronic disease and everything that comes against us in old age. So I'm Judy Liming, and I'm bouncing back from about 4.5 years from cancer. So it's a chronic disease. And I've been extremely, extremely fortunate and blessed and giving the glory to God on all of this recovery program that I've been on. It's been really intensive. If you want to know more about my story, you could private message me, and I would love to catch you up on that. Today, I'm going to be introducing a stretch from the Permanent Pain Cure. Now, I want to give all the credit to I'm sure he's a doctor of PT, but he's a PT, and his name is Ming Chew, PT. And so we're going to do this low back stretch. There are a few tips I want you to think about, and then I'm going to get into the position. It's positional. The stretches are all positional. It's myofascial stretching. The fascia covers all of the muscles, and it really helps us be healthier and move better and have decreased inflammation if we have movable, hydrated, stretched out, not wrinkled fascia. Okay. Wouldn't it be wonderful if we could do a lot of that non-wrinkling stuff? Okay. When you're in the position, you want to think about, these are things that you're going to just really think about in your head. Are my feet flexed and tilted? You want to do this up against the wall if you don't have the rebounder with the bar. I'm going to do it on the rebounder because that's kind of like my trademark bouncing back, um, with the rebounder. And with my feet up on the bar, they're going to be flexed and tilted. And my legs are going to be rotated in, so I'm pigeon toed. So when you're up against the wall, you want to check all of this. Is your sacrum or your tailbone, is it pressing down into the floor while your heels are pushing upward? Are my arms pushing forcefully over my head? That the arms over your head are supposed to feel like you're pushing away a boulder, like there's a boulder behind your head and you're pushing it. Are my wrists bent with my fingers pointing out to the sides? Is my head in position, not too high? Am I keeping a poker face? And what you're doing is you're in a chin tuck. You're making yourself have a double chin on purpose because you're aligning your cervical spine that way. And then you're going to imagine a separation between the solid sacrum and the lowest part of your low back. And it says you may actually feel this separation at first, but what you want to do, you may not actually feel this separation at first, but visualize the space between these areas increasing. And this is a psychological device. If you think about it, it'll happen. Okay, and the last one is to imagine that water is flowing into this space, permeating it with fluid. And really and truly, the disc space does that at night when we unload. It actually imbibes. They call it imbibing. Water actually comes into disc space when we rest at night, when we heal while we sleep. So after doing the low back stretch, you're going to feel that it's creating a separation between the top of your sacrum and the bottom of your spine. You may feel little cracks and pops. I'm hoping to get some cracks and pops. I need some. That's nothing to worry about. In fact, that's a sign that your spine is decompressing. After the stretch, most people feel exhilarated due to the release of tension and tiredness, a sense of letting go and relaxation. As you continue to do this stretch, your lower back will feel more and more stretched out. So I'm going to show you the picture, and then we're going to go but you're going to make sure that your feet are flexed and your toes are turned in, your legs are turned in, so you're feeling pigeon-toed. Your sacrum is on the floor. You can actually do a little sacral scoot or a sacral samba to get your butt up against the wall. Your arms are overhead, and you've got your hands. See how his hands are like they're pushing a boulder. They're kind of cupped and tilted, and he's in a chin tuck. See that chin tuck? So I have posted these pictures as well on Instagram, and so I will stop this video. I will get positioned, and then we'll go into our stretch. And hopefully, you could use your phone. And as you get up against the wall, then we can do these stretches together. And I want to fully encourage you to become pain free and to be kind to your body and to, of course, consult your physician. But we all deserve to be happy, whole, and well. So I will see you in just a moment as I get into stretch position.